Weekend AM Live on SAFM.
Bring the time now to 7 minutes before the hour of 8. South Africa is leading the way in launching mobile health services. Now, the country has developed some of the best-known and successful mHealth initiatives. Mobile Health Africa says the continent suffers more than 24% of the global burden of disease, but has an average of only 2 doctors per 10,000 people, and that is unacceptable. For more on this, we joined on the line by the manager, a High for Life program at HIV South Africa, Rob Allen. Rob, good morning. And it looks like we've lost Rob on the line there. We're going to try and get him back to find out a little bit more about the initiatives that they're busy with, the mHealth initiative. And as you heard, 24% of the global burden of disease right here on our continent in Africa, but only an average of 2 doctors. Can you imagine? 2 doctors per 10,000 people. Now that is really unacceptable. Now let's take a look at our question this morning in relation to the cricket bonus scandal and Gerald Majola. What would be the right thing for Cricket South Africa to do? That's the question this morning. Remember this just after the Sports Minister Fikile Mbalula has asked the Board of Cricket South Africa to do the right thing. We'll come back to some of your comments in a short while. It seems like we got Rob Allen back on the line. Rob, good morning.
Good morning. How are you doing?
Very good, thank you. Rob, I was just introducing this particular story because it says here that South Africa is leading the way in launching mobile health services. Can you tell us what mobile health is and how it has changed how people receive health in the country?
Okay, well, what's happening is that through mobile health, what we're really doing is we're looking at cell phones, we're looking at other devices, being able to connect people better up with health services. So that, for instance, as you said, there's a severe lack of doctors, people walk an awful long way to clinics, there's very little health information around. Mobile phones create that new opportunity for getting messaging, public health information to people in a way that hasn't been done before. In South Africa now, you're getting somewhere in the region of 80% of people with mobile phones, and that creates this huge opportunity for us to get health information to people who've never had it before.
Mm-hmm. What are then some of the main advantages of this form of health service? Is it accessibility, or is there more?
It's totally about accessibility. What we're saying is we're not replacing doctors. There are certain telemedicine initiatives which do kind of help provide that, but you don't replace the health system. You're really just supporting it in some way. You get this situation in South Africa, for instance, where the nurses, all the health staff are terribly overworked, and they don't have time to sit down with people and discuss with them about health issues. So what health is doing is able to start to allow people to access health information on their own, anywhere, anytime, and start to make their own decisions what they should be doing with their health.
Give us a typical example.
Okay, well, there's certain things, for instance, when you've got a chronic medication issue. So say you're taking drugs for TB or for hypertension or something, then there can be certain applications which will remind you when you should be taking your medication. Then there's other ones where we're sending messaging like a High for Life service, which allows you to basically just go onto the phone and access information around sexual reproductive health, pregnancy, looking after babies and that sort of thing.
Now, what are some of the major challenges that the system is facing?
Well, there's certain challenges around sort of marketing these types of applications to people. It all costs money. There's sometimes data costs and mobile phone costs for people calling in. For instance, probably the best known form of mHealth service is really a helpline. And what we find now is that in South Africa, you've got the case where the mobile operators on these toll-free lines, they're still charging on these toll-free lines. So people aren't able to access these free health lines free of charge.
Mm-hmm. So if I subscribe to the service and I got a cold and I want to find out about what sort of medication I should take, would that be the type of information that would be available?
Well, that sort of information is available. We don't make that information available, but it's certainly available through a number of different services around on the internet. or whatever, but there are health lines around for probably slightly more serious illnesses and other things that people may want to discuss around their health.
Mm-hmm. Now, can you tell us more about the Mobile Health Africa 2012 that you got going on, and what the aims, what it aims to achieve?
I think in Mobile Health Africa 2012, that's taking place in Johannesburg between 14th and 17th of May, what we're really doing is we're getting together a lot of the key people who are working in mHealth and the operators and some of the big health organisations like WHO who are coming together, and we're kind of discussing all of these issues around mHealth and how we go forward with all the initiatives in the future to make sure that they reach people and they have full impact.
That's Rob Allen, the manager at the High for Life program at HIV South Africa, giving us some more input there.